Hello, my name is Candace Acuff, and I will be presenting the research titled Reducing Healthcare Disparities Among Medically Underserved Populations Within the City of Detroit During the COVID-19 Pandemic regarding the Steer HD initiative. So some background information on this initiative. It was launched as a result of the COVID-19 pandemic and the noticeable increase of patients' lack of access to the healthcare system, and the increased use of telemedicine that attempted to alleviate the issue of declining access to care. But what was noticed was that medically underserved communities and those with socioeconomic barriers to primary care continue to suffer, and the implementation of social distancing guidelines, along with decreased availability of office visits, continue to magnify barriers for these communities. So, in partnership with medical students at the University of Michigan Medical School, the Black Medical Association at Wayne State University School of Medicine implemented the Students Training, Educating, Evaluating, and Reducing Health Disparities Intervention, also known as the STEER HD initiative. This was launched on the campus of Wayne State University in the fall of 2020, and this STEER HD initiative was purposed with improving self-management and control of hypertension through patient education and providing blood pressure monitors at no cost to medically underserved populations within the city of Detroit. The goal of our study was to address barriers to primary care during the pandemic and reduce comorbidities among disadvantaged populations in response to the implementation of social distancing and decreased availability of office visits. The methods of the study included students from the University of Michigan Medical School utilizing the 2017 AHA-ACC hypertension guidelines to develop a patient education script discussing the behavioral and dietary recommendations for managing blood pressure. Then BMA leadership organized and led orientation and training sessions for volunteer students on the Wayne State School of Medicine campus to participate in service learning opportunities. We selected patients from high-need neighborhoods through the Brilliant Detroit organization, the Rosa Parks Geriatric Clinic and Senior Outreach Program, and the All Saints Clinic, which services Latino and Hispanic patients. These were identified as our target populations, and volunteer students utilized the pre-written education script as a guide to screen for hypertension and the need for home blood pressure monitors among these patients. The student volunteers were also required to complete a PPE training session prior to participating in the distribution of home blood pressure cuffs to the selected patient population. The results of the study include the identified patient population, which included 20 patients through Brilliant Detroit, 36 patients through Rosa Parks Geriatric Clinic, and 20 patients through the All Saints Clinic. These patients received blood pressure health education from student volunteers using the STEER HD patient education script, which resulted in 76 patients receiving health education surrounding blood pressure management at home. Those patients identified as having hypertension and indicating that they faced financial barriers to purchasing a home blood pressure monitor were documented and did receive a monitor. This resulted in 64% of 49 of our patients receiving the free home blood pressure monitor. In conclusion, the STEER HD intervention provided a platform for medical students to implement clinical solutions in response to the COVID-19 pandemic through service learning opportunities. As socioeconomic factors continue to play a significant role in hindering access to care among marginalized communities, it is imperative to focus on strategizing public health interventions aimed at targeting accessibility and affordability of care within these disadvantaged populations. Thank you all, and